I'm Leah Yoha with Healthy You, and again we have Mary Catherine Globoda talking about dental health. We're back for our Part 2 series. Welcome, Mary Catherine.
Thanks, Leah.
We wanted to talk about nutrition and dental care. So MC, I call her that for short because she's a friend of mine.
That's perfectly fine. Kids know me as Dr. MC, so that's
Dr.
good.
MC.
Yeah.
So I wanted to talk to you about nutrition. How does that impact?
Well, as we left off on our last discussion, it was I sort of got the little plug in there for making sure you eat cheese. When you're finished eating, you have to make sure that you, well, not make sure, but it's a good idea to have cheese when you're done, because the cheese will actually neutralize the pH, which is the acid base level. That's a little bit more chemistry, but when it comes down to the cheese will actually neutralize it, so you can, your saliva can break things down, and that your pH, which is supposed to be a certain level in your mouth, is more stable and less chance for the bacteria, because there's so many bacteria found in your mouth, to cause cavities or cause more gum disease. But the biggest thing is the cavity breakdown of your teeth. So it's important to have a little bit of cheese at the end of a meal or before bedtime, and then brushing.
What is your opinion on dessert? And you know, kids, they love candy.
Mm-hmm.
You know, they gravitate toward it. Chocolate bars. Halloween is coming.
Mm-hmm.
So, what is your philosophy around that?
All in moderation. Of course, it's good to have sweets. We all love it. Too much is not always a good thing. It doesn't make us feel very good. So I always say all in moderation. So dessert is a good thing, but if you're going to have it, don't linger on it for an hour or two, or not even dessert so much as anything sweet, anything with sugar in it. The sugars are actually break down, and the bacteria in your mouth will break it down and cause an acid that causes tooth decay. So you want to make sure, and tooth decay is basically a cavity as we commonly know it. So you want to make sure that if you're going to have anything sweet, that you have it and eat it and get it down into your stomach as quickly as you can. You want any food or drink that is sweet to be in your mouth for the shortest amount of time, so it gets down to your stomach. Because the longer it stays in your mouth, again back to the pH level, the pH level will drop with anything acidic or sweet, and the longer it stays that way, the harder it is to rebound. And for your the longer it stays that way, the bigger the chance of the cavities will start. So it's really important to make sure that you get whatever is in your mouth down to your belly as quick as you can. So even for adults, when it comes to power drinks and
I never thought of that, because
yeah.
they're very high in sugar,
That's
aren't
right,
they?
yeah. Power drinks and coffee, and you know, people like Coke or even Diet Coke, things that are actually out there, or and not just that name brand, but all kinds of soft drinks that are very acidic. You want to make sure that it gets down. So I often tell people to, if you're going to drink it down, get it into your belly, and then have a sugar-free gum or cheese.
Okay. And now coming to infants, they don't have their teeth yet, right? Within their first year of life, probably 8 to 12 months, they start having teeth. So with gums, how do you care for their gums? You know, if they're drinking milk, they start their solids, what do you do to prevent?
There's a couple of things there. It's really important for parents to remember that we, as adults, have bacteria that are naturally found in our bodies. So we have to make sure that we don't pass that bacteria to our children, so that we don't lick the spoon and then put it in the child's mouth. Those kinds of things are simple things to make sure that we're not passing the bacteria, especially if we, and that's something that we don't think about, but if we have a high cavity rate, that we go to the dentist, or we know that our teeth are broken down, if we don't go to the dentist, but that if our teeth are broken down, that we aren't, because of the cavities that are there, or gum disease, even the bacteria from gum disease, those bacteria, we're planting it into that child's mouth where they may not already have it. Okay. So it's really important that you don't pass the spoon from your mouth to your child's mouth. Always have the spoon just for the child. That's one step. The other thing would be to make sure that they're keeping clean. You can take a little face cloth and just massage their gums. There's some great little kits out there that are, you know, 3 stages of, one's like a little nubby toothbrush, so they actually get used to having something in their mouth, and the next step is almost like a little toothbrush with plastic, well, not plastic bristles, but rubbery bristles, and then the next step would be a toothbrush itself. There's an adult toothbrush, or longer toothbrushes for the adults to use to sort of massage the gums. There's different things. It's just a matter of just keeping them clean as much as possible, as keeping their mouth clean.
I know too, like once they come into the toddler stage, you know, when they go to sleep at night, they still like to be soothed with milk. But at that stage, they may be at a bottle. So can you still put them to bed with a bottle with milk?
Same idea.
Same idea.
Let them have it, but try to let them have it quick. Don't let them sip on it all night, because there will still be sugar in some of the milks, and the formulas out there have sugar in them too. So, you know, there's natural sugar in juices, so not to put the child to bed with juice, to make sure it's with water. But if it's the formula or the milk, there's still going to be sugar in there. So if they're going to have it, and then take it away. So I wouldn't leave them in the crib with the child if they like to suck on it or sip on it all night.
I'm definitely going to keep that in mind for my little ones. So thank you, Mary Catherine, for being here again for our Part 2 series.
Well, you're welcome.
And I'm Leah Yoha for Healthy You. Stay well and be fit.